Welcome. Welcome to the Racial Equity Rapid Response Team's 1-year anniversary roundtable. I'm Sybil Madison, your Deputy Mayor for Education and Human Services. Really happy to be here celebrating a year. It was a year ago today that the Mayor commissioned the Racial Equity Rapid Response Team, a diverse collective of individuals representing communities and organizations focused on, first, defeating COVID and the devastating effect it has had on Black and brown communities all across Chicago, and two, building a foundation for work that we need to continue to address the health inequities, the long-standing health inequities that we have here in the city. I'm really happy to be here with Candace Moore, our Chief Equity Officer, and I'm going to turn it over to her to introduce our friends.
Awesome. Good morning, everyone, and thank you for joining us. My name is Candace Moore. I serve as the Chief Equity Officer here in the Mayor's office. And I have the distinct honor of welcoming and introducing you to this mighty, mighty team that has become the Racial Equity Rapid Response Team. So here in the room with us is Dr. Carol Adams, who co-founded and leaded South Shore Works, Luis Gutierrez, Executive Director of Latinos Progresando. And then joining us virtually, we have many of our other community leaders. Carlos Nelson from the Greater Auburn Gresham Development Corporation, Darnell Shields with Austin Coming Together. They're waving for everyone. Katia Nuquez from Enlace, James Ruddick with Northwest Housing Center. And then in addition, at South Shore Works, there's Ernie Sanders, Yvette Moyo, Anton Sills. And then I don't want to forget, we have many of our community leaders, but we also have a mighty team of folks who represent the healthcare industry, who are doctors who work at healthcare facilities. So I'm just going to run through. We have Deborah Wesley with Mount Sinai, Dr. David Ansel and Darlene Hightower from Rush, Mary Kate Daly with Lurie Children's Hospital, Angela Waller, Advocate Health, Susanna Vasquez and Selwyn Rogers with the University of Chicago, and also Brenda Battle. CDPH, our mighty team at CDPH, Patrick Stonehouse, Kate McMahon, Jenny Turner, Tamara Mahal, and then many others from the city, both in the mayor's office and other offices across the city. But last but not least, I certainly want to lift up our partners who helped us start this, Westside United, Aisha Jaco and Tanisha Jones, who have been our mighty, mighty partners as we moved along in this work. I certainly hope I haven't forgotten anyone. There's been so many people that have invested in this work and have built this work, and we're just so grateful for all our partners. I see, actually, I did forget someone, Jessica Viggs with Southwest Organizing Project. I didn't want to forget you as well. So please don't get mad at me for if I missed anyone. And Carmen Vergara, sorry, I'm seeing all of them. And Marcus Betts with UIC. I could do this all day. So I'm going to stop. Please know that it's all in love, but that we have a really, really mighty team representing the Racial Equity Rapid Response Team. And with that, I'm going to pass it to our mayor, who can tell us a little bit about the origins of this team and how it all got started.
So good morning, everyone. I am humbled to be here in your presence. I want to say thank you for the tremendous work and time and sacrifice that you've all committed to this mission that we've been on really for now just a year, seems like longer, and more steps to take on our long journey to making sure that we really bring equity to every neighborhood, particularly when it comes to health and healthcare. So thinking about the origins of the Racial Equity Rapid Response Team, early on in the pandemic, and I want to recognize, by the way, our great Public Health Commissioner, Dr. Allison Arwady. But early on in the pandemic, we were concerned about the disparate impact of the virus on communities of color. And what we learned was early on, we were having difficulty getting the people that were doing the testing to include the demographic information, which was so important for us to be able to understand how this virus was hitting different people in different neighborhoods. When that information started rolling in, what we saw initially was absolutely devastating. We saw that Black Chicagoans were dying at 7 times the rate of any other demographic in our city. 7 times the rate. I remember learning that information on a Thursday and feeling like someone had literally knocked the wind out of me. I knew that we couldn't just tell this story without offering up some concrete solutions. So I pushed the team to think about how we could best address this glaring disparity. And while we didn't have a lot of information at that time about the impact on Latinx Chicago, we feared that it was just as bad, if not worse. So over a couple days and a weekend, the team worked, and I remember having a convening call that Sunday night and came up with a series of options. They're smiling at me because they know I pushed them and said, this isn't good enough. We've got to do more. And I urged, let's contact Westside United. Now, I knew of Westside United from several years back because of the incredible work that was being done to really address the life expectancy gaps on the West Side. And I believe that Westside United would be a great and important partner for us in the work that we needed to do over the course of this pandemic. And so I think Sybil or Candace reached out, called, talked to the folks at Westside United. They agreed. That was Sunday night late. And the next day, that Monday, is when we announced both the news of the racial disparities that we were seeing, but also a concrete way in which we were going to address it. And in those early days, a lot of the work was really trying to understand where we should be going. That in some ways was easy because we followed the data and the areas of the city where we were seeing the highest incidences of deaths, but also how to engage, how to do it in a way that was authentic, how to do it in a way that was responsive to the needs of the local community and not coming across as City Hall bigfooting down into communities. That's been important, hard work, a lot of lessons learned. And I remember in those early days, we spent a lot of time myth busting. I think Candace had a lot of town halls and other discussions like that Black folks couldn't get the virus. That was only something that white folks could get, when in fact the first person to die in the city of Chicago was a Black woman who contracted the virus. So a lot of work has been done, and I'll wind down this part of my remarks by saying this. The charge that I gave to my team, that I think that they have fulfilled magnificently, is let's not build temporary scaffolding around a problem. I look out at this Facebook crowd, and I know that many of you have been in this work for decades. And I'm looking at Dr. Ansel in particular. And what we must do in this moment is take advantage of the opportunity to educate, to listen, and to reach people where they are so that we build a community health network that will see us through the other challenges that we are continuing to face on top of, or maybe underneath, the pandemic. I want a foundational infrastructure across our city that reaches those who are most vulnerable to healthcare disparities, life expectancy disparities, so we can continue the hard work of shrinking those gaps and connecting people up with good quality, inexpensive care. That is the mission that I believe that we have been on, that will continue post the pandemic, and we will be on this journey with all of you together because of the importance of bringing a healthy Chicago out of the ashes of this pandemic. There aren't a lot of good things to say about 2020 and how hard hit our city has been, but one of the shining lights, without a doubt, is the work of this racial equity rapid response team, and the way in which we've widened our lens, put additional seats at the table to make sure that we're talking about Black and brown lives in the city in a way that we haven't done before, and that we're actually not just talking, but we're doing. We're doing things in a way that truly is saving people's lives. So I will end by just saying thank you for the good work, more steps to take in our journey together. And now, I think I'm turning it, am I opening up the Q&A?
You sure are, Mayor.
Okay,
I
great.
think you might have a question for Aisha Jaco, Executive Director of Westside United.
I do. Aisha, I'm wondering if we can get this on a gallery view, because it's now on a speaker view.
Thumbs up.
Can we change that? All right, great. So my first question is to Aisha, our partner, invaluable partner from the very beginning. And the question is, it's been a year since you first answered that call late on a Sunday night, and thank you for picking up the phone. What was the Racial Equity Rapid Response Team like when you first got involved, and how has it evolved over time?
Team began as a phone call on a Sunday night with Westside United in the mayor's office, strategizing around how we could come together with a response to address the high mortality rates in African American communities. From there, it evolved to a framework that was presented the next day on a Monday at a press conference. From there, it evolved to a collaborative of community leaders, healthcare providers, and public health practitioners. By Friday, we were a full-fledged operation, meeting 7 days a week at times, around the clock. We became a centralized command center, deploying PPE, food, rapid testing supports, driven by community at the forefront of this work, really providing a blueprint on where resources should be directed. This was the first model of its kind for our city, where we put community leaders at the forefront, pairing them with the resources of our city government, pairing them with the expertise of our healthcare practitioners and systems, and also coming together with the CDPH to make sure we had timely data. This framework was also bolstered by the project management support from the Civic Consulting Alliance, and we have been moving full steam ahead, working to mitigate a COVID response and recovery model that has now moved into the vaccination space. So when we think about how the work has evolved, we now have a model that we can refer to when we're thinking about the best way to deploy resources in response to a pandemic. We are a national model. Other cities look to the work that we've done here in Chicago to guide their responses. And we have really did an amazing job of working together to leverage the power of community. The first responders on the ground from South Shore, Auburn Gresham, Austin, Belmont Cragen, Pilsen, Little Village, our leaderships from SWAP, and all over in communities that have had the highest mortality and infection rates. And so we have evolved into something that began as a phone call to a model that we are very proud of, because we've been able to save lives, and we look forward to continuing the work that needs to be done to make our city safe.
That was very powerful and well said. I just want to pick up on one point. A lot of people are asking us now, how is it that the city has been able to turn things around from vaccine hesitancy to vaccinating now every week, over 50% of the first shots going into the arms of Black and brown folks. And what I say is that work began back in April with the creation of the Racial Equity Rapid Response Team and the hard work that has been done every day since then. We would not be where we are now without the work that you all have done. So I just want to make sure that that point is also emphasized. We are reaping the harvest that you sowed many, many, many months ago. So let me now turn to Dr. Carol Adams, who's here with me, I will say in studio. Dr. Adams, it goes without saying that you are really a long-time, well-respected community leader and public servant, and really a household name to many. First of all, I want to thank you for all the work that you've done over the course of a lifetime and your commitment to service, and being the co-founder of South Shore Works Collective. You've been here since the beginning of the work as well. What is one pain point that the team has experienced, and how did you work through that?
Well, when we found out in South Shore about the high incidence of COVID there, we felt very unprepared to respond because we're a community that has very few direct service organizations. So we really had to ramp up, and we had to ramp up quickly. And so what was important for us was all the resources that became available to us immediately. I mean, we had to work and meet, and we met every day, sometimes 3 and 4 times a day. But all the things that we needed, we got quickly, and we were paid attention to. What we knew about the culture of our community was able to come into play when we looked at what was going to be our response. When we needed to get food and other things to get to people, and even emergency money that people needed, we were able to do that. And it came from the city, but it also came equally as important from our peers, the other organizations. We learned from each other. We learned from veteran organizations, and they pulled in to help us in South Shore because they knew that we had been an all-volunteer army. So we didn't have massive staff like some of the organizations did, but they came in and helped us too. So I think that it was pulling together this coalition between city and community that has really been very important. And you mentioned that I've been at this for a few years. It is rare for us to see this level of inside-out, bottom-up work where the community is not just heard, but it is heeded. So the team has been magnificent. I'm not just saying this because, you know, Candace and Sybil paid me beforehand, but they have been just very hardworking. Westside United, CDPH. It's just been a collaborative par excellence.
That's great. I want to also highlight one point that Dr. Adams made, and that's the issue of preparedness. And one of the things that's really important, I think, for everybody to understand is how we were prepared as a city. You remember in those dark, early days of the pandemic where you heard stories of people scrambling all over to find PPE and the other necessary equipment, people on tarmacs and far-flung lands with suitcases of cash. I wish I was joking, but those were the realities back in March and April. And the reason you didn't hear that about the city of Chicago is because of Dr. Arity and her team's preparedness. Not only were they prepared to be able to respond and guide us through this pandemic, they had the equipment and supplies because they prepare all year round, year in and year out. And that has served our city so well. So there are many, many reasons why we need to give thanks to Dr. Arity and CDPH, but that is a critical one. Let me now turn to, this question is for everyone. What are some of the pain points of pride and accomplishments that we should highlight? And what I'll ask you to do is, I think you can raise your hands perhaps, or literally raise your hand, and I will see you and call upon you.
Mayor, I think for someone like myself, I had the opportunity to work with people like Dr. Adams.
The space has really allowed for the evolution of an authentic and truly accountable relationship between community and government. Now, that doesn't mean that this has always been pretty or without disagreements, but having the relationship that can allow you to actually sit in tension in the name of better outcomes for Chicago is just absolutely invaluable and something that we need to replicate and we need to practice so that we can get better at it and carry it throughout all of the work that we do. But it really is that relationship that I have found to be a point of pride and absolutely one of the most encouraging things about this work.
Thank you. Let me go now to Luis, who's also here with me. Go ahead, Luis.
I think, through all of the things that have been difficult through this time, I just come back to the fact that Dr. Adams, Sybil, Candace, I had not had the opportunity to work with any of you before. And this gave me an opportunity to meet and learn from you and extend that to other neighborhoods. I mean, I look at the screen and everybody on that screen is a hero.
Yeah.
And so I've been out to South Shore, I've been out to Auburn Gresham, and these are the experiences that are building a better city. Black and brown relationships at the forefront of these conversations. And so that's been one thing that I would like to highlight for the work that's happened in our group.
Yeah.
So Dr. Adams and now Luis have alluded to this. I'm curious, and I'm going to call on specific people. How many of you have now met and been in relationships with people that you didn't know before a year ago? If you can just raise your hands on the screen.
And us too.
So that's quite a few. And what it seems to me is that this initiative, I'll call it, has given people across the city the opportunity to see and understand at the ground level what's going on in other parts of the city. Let me call on James. Go ahead, James. Go ahead, James. James Reddick.
I don't see him.
Go ahead, James. Go ahead, James.
Hey, Mayor Lightfoot. Hey, Dr.
That's so James.
So James.
Yeah, that is so James.
With my headphones. It's funny. Jessica and I got to see each other in person for the first time 2 weeks ago, and I said I've only seen you on camera. I've never seen you as a person. And Jessica's not the only one. I think Dr. Giles from UIC, Dr. Ansel. I had never met you in person. I had the pleasure of knowing Carlos already, and Katia, Louise. I don't think we worked together. Dr. Adams. I had never had the pleasure of meeting you. So I think particularly for folks that aren't in our geographic area or in the sector in which we work, it's been a beautiful opportunity to connect with them and in a way that is a really deep and honest relationship. And I think we've been through this with each other, through good and bad, thick and thin, right and wrong. And that's my reflection, that it's really been a powerful, transformative experience.
Side in North Lawndale, and I had never seen an effort where the city, community stakeholders, various public entities come to the table with a sympathetic and an empathetic approach that, as Dr. Adams alluded to earlier, truly considered and also acted on the council advice, recommendations of the people. So. That's been my biggest takeaway from this experience, and my hope is that this model will continue, as Aisha alluded to, the national model, we believe, will continue to grow and impact other areas in our city.
Thank you, Marcus. Next, I'm going to call on Carmen Vergara. Carmen, the floor is yours. And then after Carmen, we've got Tanisha Jones. Go ahead, Carmen. You've got to unmute yourself, Carmen. There you go.
Good morning, everyone. My name is Carmen Vergara. I'm the Chief Operating Officer of the Health Centers. And I just wanted to say that this year has been extraordinary for the Racial Equity Rapid Response Team. Being at this table, I learned about so many different systems and how things work outside of the healthcare sphere. And it's taught me how to collaborate with other areas that improve the lives of patients across the city of Chicago. And so that's one of my biggest reflections from this process, and I think it's something that I would love to see continue beyond COVID and to be applied to other healthcare issues in addition to other issues that really are part of Chicago's day-to-day, both from the recruitment process but also from making things even better for residents of the city of Chicago. So thank you all so much for all of the true effort of being at the table and being so genuine with not just your thoughts about how things should be done, but also bringing the community voice to the table as well.
Thank you, Carmen. Next, we'll call on Tanisha. Go ahead. Take it away. Don't forget to unmute yourself.
Good morning, everyone. Sybil, I didn't really have my hand up, but I just want to say good morning to the mayor, to Sybil, and I'm just so grateful for this group and having an opportunity to work with this group over the past year. As you've heard from many of the speakers, this group is very unique. We've accomplished many, many, many things this year together as a group, and we didn't always agree, but we always pushed through to get things done on behalf of people. So just grateful to be a part of this group and to have had an opportunity to work with it.
So you have to know that anytime you're in a room with me, you could be called upon. But I did think you had your hand up, Tanisha.
Mayor, can I add one comment about the model? I think throughout this pandemic, I really think about how much you've really impressed upon us of paying attention to data and letting the data lead us. That has also been true of the Racial Equity Rapid Response Team. And I want to make sure I lift up Eve Shapiro and Dr. Wayne Giles and CDPH, because what they did for us is that they helped us center data even as we were having lots of conversations about all of the pressures that exist in the community. And you've heard people note over and over again, there were disagreements, right? But one of the things that we always kind of held as a principle is that we were going to have honest, hard looks at the data about what was happening where, and then ask those additional questions about why are we seeing these things? What does this tell us? And so our community leaders, I've always appreciated the way in which we've been able to center data in our conversations, but then use that to elaborate and understand about the histories of our communities, the unique situations of our community, and then use that as our North Star for what's next. And I think that's been a powerful part of this type of collaboration. I always say, yes, government, yes, community, but it is that ability for us to both share the problem, share the data, and then ultimately share the solutions that I think has made this to be something that has been really different and really special in work.
That's great. Let's now go to Carlos Nelson, and then after Carlos, we'll go to Katya Nunez. Go ahead, Carlos, take it away.
Good morning, Mayor. Good morning, everyone. I just want to echo a few things that have been said, really about all of the partners on this Zoom, and OMC and the team from the city, Candace and Sybil, and all of OMC really came out to the community in a way that I have not seen in my 18 years of community development work. The partners in different fields in different areas of the city coalescing around fighting, this horrific disease. And Mayor, I remember a year ago at a press conference there, as my heart was heavy, as all the aggression was the community that had the very first COVID-related death, and the numbers began to kept increasing. And I remember saying, Mayor, if we had a health access to quality health care right here in home progression, maybe we could have saved that life or those lives, or at least supported many lives. And out of this racial equity rapid response work, you found resources to help push our all progressive healthy lifestyle hub across the finish line in partnership with the Christopher Crawford Foundation and the city and other areas. And a partner like the University of Illinois Hospital stepping up to run this immediate care center will actually be one of the greatest legacies in this very unfortunate experience that we've had over the last year plus. So I want to thank you, and I want to thank everyone in our partners.
Well, thank you, Carlos. And I just want to reflect on another point coming from Auburn Gresham. When the pandemic first hit, we were really focused primarily on three things. One, making sure that our healthcare system could survive what we were fearful of was an overwhelming surge. That was a big part of the discussions in the early days. Two was making sure that our healthcare workers and our first responders were able to carry the load as well. And third, and certainly not third in order of priority, but because we were doing all these things simultaneously, but another aspect of our initial response was making sure that we took care of our most vulnerable residents. And certainly, given the healthcare disparities that we all knew about going into it, that was a critical part of it. But in Auburn Gresham, and this really to me is a story of listening, not presuming, but listening. We assumed, based on our data, based upon what we knew about Auburn Gresham, that the biggest need there would be healthcare. But when we went into the community, what we heard from Carlos and others was food insecurity was the number one thing. And sure enough, when we checked the calls for service and we looked at what we were seeing, we saw exactly what the local community told us, which is food insecurity was one of the biggest drivers of concern in Auburn Gresham. I tell you that story just to say, coming to a neighborhood, you can't make presumptions about what you think those needs are. We have to listen to what people on the ground who are doing the work are telling us, and then supplying the resources that are necessary to meet that need. And again, to me, that's one of the big takeaways of this experience in the last year, particularly through the Racial Equity Rapid Response Team. Let me now go to Katya Nunez of Enlace. Go ahead, Katya. Unmute yourself.
Good morning, Mayor Lightfoot and everybody. I am extremely proud to be here today talking about the initiative that we have been participating in. I definitely have to echo the words of many of my colleagues about the authenticity of the relationship and that process that we have gone through when trying to address the different elements of COVID, including, of course, testing, vaccination, etc. I have enjoyed so much getting to know the people that have worked in these, both from the city and from the other agencies, the healthcare partners. It's been an incredible process in which I do believe that in terms of analyzing statistics, we have been able to create different strategies to address the issue. But also, I have been very impressed by the respect and authentic efforts to really listen to community and to create the strategies based on the assets and the needs of particular communities. So I have to say, in Little Village, we have been working with our local table, but the support we have received from the city, from Civic Consulting Alliance, and from all of our other partners at the table has been immense. And we're grateful that our numbers are changing, that we're seeing real progress in Little Village in terms of our efforts to battle this pandemic. Thank you.
To the end of our program. And the next is for Dr. David Ansel. Doctor, are you with us? Dr. Ansel, you helped co-lead the Providers Working Group, one of RERRT's several working groups. Can you tell us a little bit about the story of how the working group came together, and in particular, how it was that the Providers Group decided to put out a joint statement, and what went into that, and what the reaction has been since? So how you came together, talk about the joint statement, and then the response after the statement went out. Go ahead, Dr. Ansel. Please make sure to unmute yourself. Go ahead, Dr. Ansel.
Hi, everybody. Thank you, Mayor. It's nice to be here to reflect with all of my new friends I made over the last year, and some old friends. I just want to start by saying that the model that has been created, kind of a federated model of integrating community anchors with healthcare anchors with the city, is the model for the future. It wasn't just the model for COVID, but it's the model for thinking ahead and how we should always work together. And I can tell you, in following the data and the hyperlocal approaches to this is absolutely the right approach. And then, for the providers, it was kind of eye-opening. We were thinking about ICU beds, and the community was saying we need food. And even the way that we thought about testing, we said, well, you should be tested if you're symptomatic. And the community said, no, everyone should be tested. It really changed the way we thought about things. And then we reached out to 75,000 patients. Rather than waiting for our patients to call us, we called them. And then George Floyd was murdered. And I think the impact of both the COVID disproportionality, the uprooting at the community level that all of the providers saw around the table, and the egregious another black man killed in the United States, really led the provider table that had been focusing on how could we do better around COVID, partner with the community, to think about that we have to make a statement. And the way the statement, the way that the statement, evolved in this moment, and I know we'll probably talk about that in a little bit. But it really arose out of the partnership and the table setting that was created there. I do think that as we look ahead, we've got the idea that community anchors are as important as institutional anchors is something we should never forget. And then how do we sort of connect our systems more tightly together are going to be critical for moving ahead.
Thank you, Dr. Ansel, and really thank you for all your work that you've done, particularly highlighting the healthcare disparities that you have yourself seen and experienced as a practicing physician on the West Side. I think you've given us many clarion calls, and I hope that now you believe that we are listening and responding in a way that addresses long-term problems.
Thank you, Mayor. Really, thank you for your leadership. I think it takes a unique leadership style to set a table like this, this couldn't have been done without yours and your team's leadership.
Thank you, Doctor. So last but not least, also here with me is Luis Gutierrez, who you all know. First, thank you for being a champion of Little Village and Marshall Square, as well as leading efforts to unify Black and Brown residents. folks, I just want to make sure this moment doesn't pass without us recognizing this is a unique table for many, many reasons. But in a city like Chicago that has so many barriers, so many silos and walls, you all have broken down many of these walls, many of these silos, and come together in a way that I think is really an incredible testament to who you are, but also to the possibilities of what we can do if we look beyond race, if we look beyond zip code and all the other barriers that separate us in this, unfortunately, most segregated city. This is what the future looks like. So, Luis, I want to turn to you. It's my understanding that you've never worked with a city like this before, and ask what's different about the Racial Equity Rapid Response Team, and what are the implications for how the city should be working in and alongside communities for the future?
I think one of the things that I see that's really unique about this table is honesty, right? So Sybil, you and Candace can attest to the fact that the Racial Equity Rapid Response Team has come to you and said things that typically I've not heard in other meetings, things about what the real needs are in our community, and really have expressed that to you in such an authentic way. And I think you've listened and taken those things back. And so that's what's been making this unique. But I also think that this is the future. As we moved into vaccine rollout, we took what we learned of the COVID testing and just moved it right over. And so everything that Dr. Ansel talked about right now was just such a smooth transition for us. Now, that's not to say that there are not bumps in the road. Yeah. We certainly had that. But the honesty of the conversation between healthcare providers, community anchors, and city allowed us to look at data in real time and strategize honestly about how we make these things better. So as many people have pointed out, this is a national model, and I see this as the future of how communities need to be working with government to make their cities better. And in Chicago, we see that it's working because you see Black and Brown working together to make sure that we're bringing down those numbers and getting those vaccines out.
So I want to pick up on a couple of things that Luis just said, but also answer a question that several of you raised. This isn't the end. This group, this model, this work must continue past COVID. As I said at the outset, and my team has heard me say many times, no temporary scaffolding. We had to build a foundation on which we can grow a community health network across our city. I have no doubt whatsoever that because of the work that you all have done, the way in which you've done it, we've helped save lives. Now, there's more work to be done. We haven't shrunk the life expectancy gap. We haven't closed the problem of people not having access to high quality health care. There's more to be done. But this has really set a model, I think, that we can emulate as we take on more of these other challenges as we have the space to do it once we're out of COVID. But everyone should be looking at what have we learned over the course of this year together that we can use and carry with us into the future post-COVID. We're asking ourselves that question across the city in other work that we've done, and that's a question that should be on the table for this group as well. And then how do we approach taking on these longer term, seemingly intractable problems that really affect the quality, literally every day, the quality of everyone's life in our city. These disparities are real. The challenges at times feel daunting, but I'm inspired by the work that you all have done to make sure to know that we can tackle these things if we do it together, if we break down silos, if we listen, if we follow the data, and we provide resources to really build capacity at the local level. I'm struck by a point that Dr. Adams made at the beginning in her remarks. None of us had dealt with a pandemic before. Everyone was challenged, and we were all pushed out of our comfort zones, but we've gotten through this because of the unity and commonality of purpose, even where we didn't agree, even where we saw the same data, I suspect, and had disagreements on what it said and why it was so. There's great work that we must build upon as we look into the future, the other thing I wanted to also just say is this. We've got to tell this story. You've got to tell your story. We wanted to have something that was a moment to recognize the 1-year anniversary of the creation of this group. But just by what I've heard today, and I've been following along with the work throughout the course of this year, I'm inspired. I feel goosebumps at some of the things that I've heard today, and already thinking about more ways in which we can help support the work. But we've got to tell this story. The good stories of how we've come together as a city have to be told to uplift, encourage, and provide people with hope. And this is a story of hope. And we have to make sure that more people hear it and are able to grasp onto it as they struggle. That struggle continues.
Mayor, I think there might be a time for you to pick on one more person, but before you do that, I did want to lift up the Civic Consulting Alliance, so Geneva and Vinu, for all the work they do behind the scenes to keep everything going. And then I also wanted to recognize Margaret LaRaviere, Yumi Grigsby from the City Clerk's Office, and Jenny Turner, who's with CDPH, Margaret's with DFSS, who played an essential role in going between the table and the resources, and making sure that those resources got connected and directed to community. So I just, there's so many roles that people on the team played, and these are roles that may not seem as visible all the time, but really were the glue and continue to be the glue in terms of connecting the dots, connecting the resources. So just wanted to lift that up before we closed out.
Thank you.
Mayor,
Go ahead, Luis.
Can I just say one more thing? I wanted to highlight too, one of the most impressive things about this table to me has been that it really thought about we as a city from the start. When you have a tragedy like this pandemic, it's really easy for people to say, what am I getting, or what is my community getting? But this table really came together, and you see Dr. Adams will agree, right?
Absolutely.
Absolutely.
The cross-stakeholder engagement here has been extremely, just a very high level. And the way that communities decided to uplift and support each other. But I also have to really again say that Sybil and Candace and other people who you've had at this table have been stalwart, because listen, sometimes we would just let them have it. And they would let us have it back. I mean,
I was wondering when one of those stories was going to be told today.
I said honesty.
This was
I
not
did say
just
honesty.
where we just came gentle and we had a little meeting and at the end, no, we challenged, we pushed each other and everything, but everyone was committed to staying at the table till we had a unified approach and until we agreed. And if it could come through all of that fire, it was generally going to be good.
I see that Marcus Betts has raised his hand. Go ahead, Marcus.
Yes, thanks again. A couple things here. First of all, when I think about sort of what's been different about the racial equity rapid response team and its approach, number one, and with Candace and Sybil, I want to take a moment to thank them for their leadership in this effort. We've had a lot of different types of meetings, but I think it takes unique leadership at the table to be compassionate, receive that leadership, and facilitate an outcome. I think so we can't thank them enough for their leadership at the table. In terms of implications for the city and how the city should be working with community. Listen, I think we've got some takeaways, some big takeaways here. Number one, the organic nature of this process, allowing it to happen, allowing those voices, allowing the squeaky wheels an opportunity to come to the table and offer perspective. The diversity of perspective and thought that was at the table. You don't get some of the outcomes that I think we got and results that we got out of this process without having just different perspectives and thoughts at the table. Oftentimes, I came into meetings thinking one thing, and I walked away, wow, okay, this is what's happening in Belmont Creighton. Oh, this is what's happening in South Shore. And we were able to collectively come back to the table with a stronger recommendation or stronger course forward.
All right, thank you, Marcus. Do we have time for one more, or should we
Maybe
wrap it
Darnell,
up?
because I learned a lot from him.
Who's that?
Darnell, did he leave?
Darnell's out of the office
Yeah.
today,
All
so
right.
he couldn't be with us.
So I'm going to call on, if I can, my longtime friend, Deborah Wesley. Deborah.
Yeah.
Deborah the Warrior. Deborah, I wonder if you would offer us a few words of reflection about what this experience has meant to you and what you've seen that may be different now than what you saw in other efforts in prior years. Go ahead, Deborah.
That's the delay.
Reflection about what this experience has meant to you, what you've seen that may be different now than what you saw in other efforts in prior years. Go ahead, Deborah.
Thank you, Mayor. This has been an amazing process. What I most respect about it is that everyone was on the same journey, and that's to really make sure that the residents of our city were able to get well and be well and fight this fight together. The other piece is that we had people on this committee that have lived experiences, and that they were I want to say the public guardians, if you will, who were willing to listen to what the community had to say about the impact on themselves and on their community, and together come up with really viable, very rich strategies to try to address these issues, because the city can't do it alone, and the community can't do it alone, nor can the hospitals do it alone. We have to do it together. And so this was the perfect, if you will, opportunity to bring all of those individuals and institutions that have a vested interest in our community, led by you, led by Sybil and Candace, to make this happen. So I've been just so honored to be a part of this, and I think this is just the beginning. This is a city model, this is a national model, but this might be an international model in how you come together and get things done. Thank you.
Thank you, Deborah. So I think our time together is now winding down, but let me emphasize again a couple things. This is not the end. This is a milestone on our journey. The work continues. We have other challenges that we have to face. And this is, to steal from all of you, a model that we can use to take on and conquer other challenges in our city. There are too many things that people told us we couldn't do.
That's right.
Too big, too long, too entrenched, too difficult. Not enough resources. I think we've proven them wrong time and again. And anybody who knows me knows that I'm always up for a challenge, and particularly when that challenge involves saving people's lives. We do what we must. We roll up our sleeves. We find the resources, even in difficult times. And this is one of those times. I want to thank you all from the bottom of my heart for the work that you've done, heroic work. I think Louise said it, everybody involved in this work is a hero. You should all be extraordinarily proud of what you've done in service of city. You know, there's a famous poem by Gwendolyn Brooks, and one of the lines that gets quoted often, and rightfully so, says, "We are each other's business." That is so true. And it must be true. If we're going to be able to proceed together into a different kind of future, where particularly our children's fates are not preordained simply on the basis of where they live, the zip code, the circumstances into which they're born. We have to be each other's business. And that's what you've proven over and over again. So thank you. Thank you on behalf of a grateful city, residents who will never know your name, may not even know that this team has come together, but are the beneficiaries of your sacrifice and hard work. So thank you so much, everyone.